Hello, my name is Melissa with the City's Readiness Initiative. Have you ever watched the news reporting on an emergency in our community and wanted to know more about what was happening behind the scenes in a response? Maybe you or someone you know has responded to an emergency and you were curious about who the planning and response partners are in our region and how we all work together. If these questions have piqued your interest, then this video is for you. You will learn more about the people and the organizations that respond and how they work together, with an extra focus on public health emergencies. First, let's talk about the purpose and focus of emergency response planning. While emergency management offices spend a great deal of time planning, the single most important outcome of a written plan is the relationships that form during the planning process. As Dwight D. Eisenhower said, "I have always found that plans are useless, but planning is indispensable." Nearly every large emergency has a health or medical component. That's why local public health agencies are at nearly every planning table to coordinate health and medical resources during emergencies. When public health is developing plans, we work with many partners. All these partnerships help us establish and solidify relationships and create better, more robust plans. Our public sector partners include cities, counties, and states. We also partner with private industry and nonprofits to achieve our goals. But there are also specific planning organizations. For example, Northwest Oregon Health Preparedness Organization, a healthcare coalition, focuses on bringing many different healthcare partners together to solve healthcare challenges in emergencies. Government agencies, non-governmental organizations, and private sector stakeholders in the Portland metro region have formed a collaborative partnership called the Regional Disaster Preparedness Organization, or RDPO. They seek to increase the region's resilience to disasters with strategic planning, training and exercise, and investment in technology and specialized equipment. These partners represent law enforcement, public health, emergency medical services, fire, public works, and many more. Public health organizations and other key health representatives come together to form the Public Health Work Group of the RDPO. This group determines gaps in preparedness and coordinates projects to fill those gaps. The Citizen Corps Work Group of the RDPO coordinates funding and regional programming for all the voluntary agencies like the Medical Reserve Corps and Community Emergency Response Teams, or CERT. The City's Readiness Initiative is a regional program in our area that focuses on planning for pandemic influenza, other emerging infectious diseases, and bioterrorism events, including points of dispensing or pod planning. Pods are pop-up clinics that are set up by public health to get pills or vaccine into people very quickly. These are important elements of public health planning. It's also important to know what types of public health threats we plan for, so you can better understand the response partners involved. We know we are at risk for a large Cascadia subduction zone earthquake, so we plan with partners for that. Inclement weather happens every year, so we continually work with partners to improve those plans, as well as mass care and sheltering plans. We also plan for large-scale public health emergencies like bioterrorism, pandemic flu, and other infectious disease outbreaks. Let's use a real-life example like the 2017 Eagle Creek Fire in the Portland metro region to walk through what the hierarchy of a response might look like from the bottom up. And remember, we're not talking about the incident command system structure. We are talking about who the players are and how we are likely to work together in an escalating response. The Eagle Creek Fire started in Hood River County and quickly moved into eastern Multnomah County. It also jumped the river into Skamania County in Washington State. Firefighters got to work and people in the area were evacuated. The weather was scorching hot and smoke from the fire caused poor air quality, which is a public health concern. The counties opened their emergency operations centers to manage the response in their counties. The governor declared a state of emergency. The State Office of Emergency Management activated its Emergency Operations Center to monitor the fire, along with many other fires burning across the state, and to support the response by local jurisdictions. The counties provided information to the state, and the state provided information and resources to the counties. Different state agencies got involved and worked through the Office of Emergency Management to assist. The fire raged on, and federal resources came to assist Oregon. In this example, the counties worked with the U.S. Forest Service in the Joint Information Center. In a large public health emergency, we may receive assistance from the Centers for Disease Control and other federal agencies like FEMA. That's how a response works vertically from the bottom up. Now let's discuss how we work side by side with other partners in the region. It's important to note that cities and counties have different roles but work closely together, collaborating on planning and response efforts. Depending on the type of emergency, the jurisdiction it falls under, and the capacity of the city to respond, the county may work alongside a city or the county may wrap around the city's own response. Within a response organization, there are people who do planning, logistics, finance, and operations, but there are also functional roles for all the different parts of the response, including health and medical support. In a public health emergency, the health and medical support might work most closely with mass care and sheltering, food and water, transportation, law enforcement, fire, or search and rescue. In another emergency, health and medical support might play a less central role, but there is virtually always a health and medical element to any response. All the parts of the response work simultaneously and alongside one another to form a cohesive response. It is the job of the people working in the emergency operations centers to coordinate all these functional areas. The components of health and medical emergency support include hospitals and all other healthcare providers, public health authorities, emergency medical services, behavioral health, nursing facilities, and medical support for sheltering. There may be people working in all these separate areas who report to the health and medical function of the county or state emergency operations center. Different counties or jurisdictions may not use these exact same terms, but they all work in a similar way despite slightly different terminology. In larger emergencies, which cross more than one county or even more than one state, you'll find different jurisdictions working together on many levels and joining together in a more streamlined, unified command structure. Let's use a large public health emergency to walk through another example of a response structure. Let's say there is an outbreak of measles in a local area school where many children are not up to date on their measles vaccine. There are many cases and contacts in neighboring counties. Several children have been hospitalized. The local public health agencies are overwhelmed trying to track down all the contacts throughout the region. There is a great deal of media attention, and we are planning a prophylaxis pod for contacts and an immunization clinic for the community. Prophylaxis is medicine or other treatment used to prevent disease. Because of the volume of media inquiries and resource requests, several counties have activated their emergency operations centers and formed a joint information center. The Oregon Health Authority also opens its Agency Operations Center to help coordinate the response among the different impacted counties. And the Oregon Office of Emergency Management may also activate its EOC if additional support or outside resources are needed. Hospitals activate their own emergency operations centers to quickly discharge patients and maximize space to care for a surge of incoming patients. The Northwest Oregon Health Preparedness Organization partners with county emergency operations centers and the Oregon Health Authority to ensure that regional healthcare situation status reports are shared and hospital resource requests are received. Whether it's a small-scale, localized event or an overwhelming statewide response, public health has plans and structures in place to respond. But most importantly, we have long-standing partnerships with organizations and communities throughout the region. We are always improving upon our plans, exercising roles, and anticipating how to improve our service to the community.